So this is my video for the optic assignment. So I'm just going to go ahead and show you my little drawing first. So just going over basic things, we have the sclera in blue, so this is what protects the eye. We have the choroid in red. This is kind of what gives the eye its nutrients and provides like temperature, and it maintains things. The retina, of course, is going to be somewhere on my chart, somewhere right over here. It's the orange right here, so it touches the optic nerve. Super important. The retina is why we see light. It's what the light hits in the back of our eyes, so super important. Then we have the optic nerve, as I was saying, which is right here, this yellow part. Super important. It goes from the retina into the optic nerve. The optic nerve connects to our brain, and the brain is what allows us to go ahead and see images. Images that are in the retina, they're upside down. Once they hit our optic nerve and go to our brain, they go ahead and flip so that we can see the world the correct way. We have the vitreous humor, which is going to be right over here. So it's right in here, super important to know. The ciliary body, I'm all backwards. It's this red area right here. It is important for muscles, and it is important because it lies behind the peripheral part of the iris and secretes the ocular humerus. Let's see, the suspensitory ligament, where's that at? This white part right here. So it's also known as the Lockwood's ligament. Super important for two main reasons. It's why your eyeball doesn't fall out. It supports the whole eye, very important. We have the pupil, which is this little, I made it blue, but it's supposed to be black. Everybody knows what the pupil is. It constricts and dilates. We have the cornea, which is this outer layer right here. It's known as the windows of the eye, and it's like what allows light to come inside. We have the iris of the eye, so my iris is going to be this darker blue part. Very important. It's what makes our eyes super pretty and gives us color, but it also helps the pupil to constrict and dilate. The lens is going to be this big blue area right in here. The lens is how we change focus. So just think of a lens on a camera. You can zoom in to see things that are far away, and you can zoom out to see a bigger picture. It's exactly what our lens does in our eye. And then we have the canal eschwema, which is right up here, this little tiny part. This is important because it helps our eye drain the ocular humor. So very important. The three diseases that I chose to discuss for the just regular adult is refractive error, strabismus, and dry eye. So refractive error, it's just pretty much, there's three types. There's myopia, hypertopia, and anti-matism. Those are the three ones that affect just the regular adult and even children. So this is why people are nearsighted, farsighted, things like that. So super important to know because you don't want somebody not being able to see. For me, I can't see far away. So there's something off in my eye. This is due to the eye shape. So you know, if your eye is too short, it's going to cause you to be farsighted, and this is known as hyperopia. Myopia is when your eye is too long, and it causes nearsightedness. And then the, let's see, anti-matism, it's when your cornea has a curve in it. So your cornea should be a curve just like everything else, but it kind of just curves in a little more in the middle. This isn't good. It causes you to not be able to see lines correctly. So just think of a circus, and the lines kind of being wavy while you're looking in that crazy mirror. The second disease was strabismus. So this is when we can't focus both of our eyes at the same time. So this would be like a person being diagnosed as cross-eyed. The eyes can go in tons of different directions, so they can go this way, that way, up, down. It could just be one of them or both of them, but your eyes aren't able to focus together. This causes the person to be have double vision. It's your eyes, so it's very seen to other people, and it can be diagnosed. It can be diagnosed just by seeing it. It can be diagnosed through other tests such as a cornea light reflex test, an alignment test, a focus test, a retinal exam, things like that. And it can be due from many things like stroke, Down syndrome, cerebral palsy, detachment of your retina, neuromuscular problems, thyroid disease. So this all has to do with the muscles in your eye. Super important. The next disease was dry eye. So this is when inflammation happens. It causes it to push on your eyes, which causes there to be less tear production. It can be from an injury. It can be from a disease known where you sleep with your eyes open. So this can be diagnosed through a dry eye test. It can be diagnosed with a history, a split lamp examination, and tests like the Schwimmer test or the tear breakup time test. And then there's also 3 common diseases for the older adult, and I chose cataract, diabetic retinopathy, and glaucoma. So cataracts are well known. They are so they affect our lens of the eye, so it's why people with cataracts have that fogginess in their eyes. So the lens of our eyes is normally just made up, I'll show you, lens of our eyes is just normally made up of water and protein. As we age, these proteins get broken down into our eyes, they start building up, and they cause that cloudiness in the eye. So super important. This can be diagnosed with an retinal eye exam, so dilating the eyes and checking the eye health of the eye. Diabetic retinopathy occurs in people with diabetes. This is when the pressure, let's see. This is when the blood sugars get way too high in the blood. They cause the blood vessels to either completely stop because the pressure, or it causes the blood vessels to leak out into the eye, which causes the eye to be red. Not good. It results in major changes such as seeing halos around lights, blurred vision, noticing large amounts of floaters in your eye, seeing random flashes of lights in your eye, having poor vision, or just sudden loss of vision altogether. This can be diagnosed with a diabetic eye exam that also dilates the eyes. And then glaucoma, again, super well known. There's many types of glaucoma. This is when the intraocular pressure is just too high, and it causes pressure to be put on the optic nerve. So there's a whole bunch of fluid that's not draining out of here. It's pressing on this optic nerve, which causes us to not be able to see because it's not allowing the images to be passed onto the optic nerve into the brain. Let's see. This can be diagnosed with a glaucoma check, testing the peripheral vision and the optic nerve. And then the treatment and management. So for refractive error, getting glasses, super important. You can change it, glasses, contact lenses. We can get LASIK eye surgery. So there's many things. It's super important to always go to your appointments. For strabismus, just like refractive error, you can try glasses. It's probably not going to work. So usually they can do just like physical therapy. They can do ocular therapy. That's like when they cover one eye with an eye patch, making this eye work harder, causes you to strengthen the muscles in your eye. And then the last result would be to do surgery on them, just to correct the muscle in the eye so the eyes can go straight. Dry eye treatment, super easy. Artificial tears or anti-inflammatory eye drops. You can get those both over the counter. If you have chronic dry eye, you can get surgery. They'll go in and put a plug on your duct so that your tears aren't draining out constantly. Cataracts, only way to treat this is with surgery, unfortunately. So this is why preventing this is super important. Diabetic retinopathy treatment is to control your blood sugar. When you get diagnosed with diabetes, always have a diabetic eye exam yearly. And then glaucoma, also irreversible. Treatment for this is to keep your IOP super low. So manage your stress, manage your blood pressure, things like that. They can do surgery as well to drain the fluid that's in there. And then nursing management, so refractive error. Just see how they're coping, making sure that they're coming in for their annual eye exams, making sure that they're getting different lenses. For strabismus, would be to teach about the therapies that are there and why they're important. Make sure that they're not, at risk for injury because of their double vision. For dry eye, the nursing interventions management is to just educate on blue light shields. You can get blue light glasses, you get shields on your computer. Look away from your computer at times, blink your eyes often. Try to get that tear production going. So these are just ways that you can help yourself that aren't having to get medications or things like that. Don't rub your eye, you'll cause damage to it. And learn how to apply eye drops. Cataract nursing interventions. Just make sure that the patient gets their eyesight back after surgery within a couple hours. Make sure they wear sunglasses to not damage their eyes any further. Teach them how to put drops in. And just maintain an appropriate intake of vitamins like vitamin C and E, and have good nutrition. Same thing for diabetic retinopathy. Super important to control your diabetes. So just making sure that you know your glucose levels, you're checking them, you're eating a good diet, you're living a healthy lifestyle, you're exercising. You want to keep those diabetic numbers low. And then for glaucoma, nursing interventions and management for the disease is just to comply with your therapy. Educate and to reduce stress, so teach them stress coping mechanisms, you know what I mean, give them blood pressure medications if they need it, explain why they need such things. You just want to get the IOP low, you don't want that pressure back there. So yeah, that's my video. Thank you.